Hi guys, how you doing? My name is George, and today we're going to be talking about assessments, specifically concerning recreational therapy. So what is an assessment? An assessment is the systematic distribution of methodology and tools within the domain of therapeutic recreation. Assessments can evaluate physical, mental well-being, strengths, limitations, and challenges, whether that be through injury or cognitive disability, leisure and recreation preferences, and the needs of the client. So what is the importance behind an assessment? So the APIDE process is a fundamental tool used in program planning and facilitation of care. The first step of the APIDE process, assessment, allows for the professional to understand the level and functioning of the individual in order to create an established plan of action within the planning step. So an assessment can evaluate, as I said, the strengths, limitations, challenges, leisure, recreation, preferences, and needs. And it is the first step within the APIDE process, which concerns assessment, planning, implementation, evaluation, and documentation. So there are many types of assessments within therapeutic recreation. These include objective assessments, which are observable and measurable data using the senses that cannot be argued. These assessments, examples can include palpable or observable assessments of physical ailments that act as a challenge to the client. Physical ailments can be a burn, maybe they can be an amputee, but something observable and measurable. Subjective assessments include information which is documented through the perspective of an individual. Let's say the client says that they have pain in a certain area, such as a stomach ache that has been presiding for a couple of days, or a client disclosing that they had trouble breathing throughout the past week, which can be seen throughout the COVID-19 pandemic. Another type of assessment is agency-specific versus commercial. So agency-specific assessments are created on-site, and they may not have the same reliability and validity compared to a commercial or standardized assessment. For example, in my place of work, we use an intake assessment. This, we go over the client's age to see. I work in geriatric care, Alzheimer's, dementia, long-term, as well as rehabilitative care at a nursing home. And we used our assessment, which is created by our recreational therapist. And it just measures, can they tell their age? What's their cognition? What's their sociability level? What preferences do they have concerning the activities we provide? And that way, through this assessment, we can create a care plan specific to the individual. So as I said, examples include intake assessments focusing on activity preferences, quarterly care plan, and evaluation regarding goals. Commercial assessments are standardized assessments provided by a reputable body of researchers. These are tried and true assessments that can be seen throughout our field. Examples include the Cohen-Mansfield Agitation Inventory, CMAI, the Depression, Anxiety, and Stress Scale, DAS, and some more assessments are standard versus non-standardized. Standardized assessment include research and established assessments, which provide appropriate validity and reliability standards. Examples include the Geriatric Depression Scale and the Montreal Cognitive Assessment. I'm going to be covering the Geriatric Depression Scale in this video. Non-standardized are less accurate assessments, which can often be developed by an agency, not always. Examples include, as I said, intake assessments at a long-term care facility or adult day training programs for individuals with cognitive disabilities. Short-term versus long-term assessments include a short time period in which an admission, intake, and discharge is administered. Examples include rehabilitative care after a fall injury. I see these on my site in my facility, as we have a lot of individuals that may have suffered a fall, broken their hip, or had a complete knee replacement. In this case, we do an intake assessment. However, socialization is limited due to their time with rehab and the PTs and OTs. Long-term are longitudinal assessments in which figure or status is recorded over time. This is when some construct or some element is being assessed throughout different sessions. So as I said, concerning a total knee replacement. An individual may come into the site and an assessment is taken to measure the degrees of flexion. My grandma actually just is recovering from a total knee replacement, and this is the type of long-term assessment that they're performing on her, measuring the degrees of flexion, comparing it to her knee that is not been replaced. So now we're going to go to the database provided. And this database provides a lot of rehabilitation assessments. It can be recreational therapy, occupational, physical. And so I'm just going to look up here geriatric. And we can see all the different types of assessment tools provided for geriatric care. So I'm going to be focusing on the geriatric depression scale, because I feel like mental health is a very important note now in our society. As we can see here, the purpose of this assessment is to assess depression and suicidal ideation in elderly individuals. The problem concerning this assessment is that it's very much needed, as isolation and loneliness is a very big problem within geriatric care. So this measures CVAs, brain injuries, Parkinson's disease, and neurological rehabilitation. The cost of the assessment is free. All you need is a paper and pencil. And it has actually a short form and a long form, that being 30 items or 15 items. So as you can see here, either 30, 15, 10, or 4, and it takes around 5 to 10 minutes to perform the assessment. The reason why this assessment is, I want to look at it, is because when I perform assessments on my clients, it's difficult to see agitation in them due to the fact that so many people are bombarding them at the same time when they actually get to the rehab stage. And this assessment only asks yes or no questions to determine the depression and suicidal ideation. So as you can see here, I have a short form of the scale. It asks basic questions. Are you basically satisfied with your life? Do you feel happy most of the time? Do you think that most people are better off than you are? It assesses a score, yes being a score of 1, no being a score of 0. And after a certain score is reached, that's when depression is hinted. Now, this isn't a complete diagnosis of depression. More psychologists and other mental health professionals are pointed in the client's individual after performing this scale, because it's not a complete diagnosis. Right here is a long form, and you can take a look at that right there. So do you feel pretty worthless the way you are now? Do you find life very exciting? Do you enjoy getting up in the morning? And here is a key, more explanative key. This is, cut off, severe depressiveness, and like a key for the answers that you may see. So the age range for this assessment is individuals that are 65 and over, such as the elderly, people that can, suffer from CVAs and strokes, to Parkinson's, and can be also some forms of dementia and Alzheimer's. So if you scroll down, you can see the authors who reviewed this assessment, who created it, as well as another key over here. You can see the populations, as I mentioned before, older adults and geriatric care. And if you scroll down, you can see the validity and reliability respective to each population that they tested on. So I'm going to focus on strokes and CVAs. And we can see here the cutoff scores. the test and retest reliability, which is the test and retest reliability is how the consistency of the findings of the assessment throughout a certain point of time. So how consistent is this assessment? The inter-rater/intra-rater reliability, inter-rater being the reliability which refers to the consistency of data recorded by two or more observers measuring the same construct. So when two or more observers are measuring the construct, how consistent is their results? The intra-rater being the reliability of one rater and the consistency through multiple trials they perform of the assessment. Internal consistency being how the reliability, which measures how the multiple items within the assessment perform under the same constructs. Predictive and concurrent validity being how the GDS was measured against an established assessment to see a comparable and valid outcome score. Predictive, the extent of the validity when concerning a prediction of future performance in respect to the variable. And that's pretty much all the figures they show. The construct validity is the extent of the assessment performance concerning whether it accurately assesses what it's supposed to, does it measure what it's supposed to measure. And these figures are important to note, validity and reliability, because reliability tests whether the data is trustworthy. And validity being how does the test perform related to the construct it's testing against. So what characteristic the test measures and how well it measures against that. And these figures are important because when we're looking at standardized assessments, we want to ensure that we're using the most reliable and valid data we can use and assessment we can use. Because, you know, concerning my agency specific assessment that I use day to day, although it works within our situations, this is due to our population in South Florida. And I can see this agency specific assessment that I use not working with certain populations of the same geriatric care.